Peak oil. He talked about chemistry. He talked about global warming.
With skillful
he talked
manipulating
about
of
UN.
press,
He talked about the NWO.
they're able to make the victim
They're
look
prepping
like
for mega.
the criminal, and the criminal look like the victim.
Once the red carpet gets rolled out for this New World Order program, everything is free game.
I welcome you to Make It Plain TV.
You still don't get it, do you, boys? There ain't no countries anymore. No more good guys. They're running the whole show. They own everything, the whole goddamn planet. They can do whatever they want. What's wrong with having it good for a change? Now, they're gonna let us have it good if we just help them. They're gonna leave us alone. Let us make some money. You can have a little taste of that good life, too. Now, I know you want it. Hell, everybody does.
You do it to your own kind.
What's the threat? We all sell out every day. Might as well be on the winning team.
So I just got to work. I'm not trying to be unprofessional. I'm upset. I just quit my job. I clocked in, found out that I'm being sent to a corona floor when they know that I have kids at home who I can't send away for, to stay away from me. My manager sent me to a floor that is being tested for corona. She knows my health history. She knows all of this. I quit. I care about the patients and all, but my family and my life, they matter. They come first. Lavika Stewart is evil. She's evil. She knows my health history. I told her my kids don't have anybody to go to while they're here. I can't send my kids away like everybody else. I'm done. I'm leaving. My life matters and my kids matter. Screw this.
Hey, Queen, how you?
Doc, I'm good. My cousin that lives in New York called me and she said, they're talking about you on the radio up here. I was like, what?
That's Shaniqua. Shout out to Shaniqua.
That's only my cousin Shaniqua, yes. That's only a small part of the story, what everybody's saying. There's so much more behind what forced me to make that decision. I mean, I didn't want to leave my job. That's the last.
Now, wait, Melissa, before you get into it, just for backstory in case people didn't hear, you quit your job on Instagram Live. You're a nurse.
Okay, so for starters, when the coronavirus outbreak, came to our area, I've already taken care of coronavirus I've already been assigned one of those patients, okay? After that patient, it was a patient that was being tested for coronavirus, for starters. My concern, I even brought my concern up to the charge nurses, my team leaders. I'm like, hey, here's a part of the story that people don't know. My husband is in another state. He's not even here. Like, if I have to self-quarantine, who's going to watch my children? It's not the fact, because I have children. It's who's going to watch them if I have to be self-quarantined. That's the thing. After I took care of this initial patient, I felt sick the following weekend. Like I was coming down with a cold, and all I could think about is, was this patient positive? So when I went back to work, I asked my team leader, I said, how will we know, or will we be notified if our patients come back positive? Oh, yours was positive. Your manager, I don't want to say her name, the manager should have sent you an email. I said she didn't. I pulled it up then. We looked, double-checked, no email. Everybody else that had contact with this patient, they're like, oh, she called us. She emailed us. I felt some type of way about that. I said, why didn't she contact me? Because, I should know. So then my team leader said, well, it's probably because you had the proper PPE on at the time of care. I did not feel comfortable with that because there have been reports of still contracting the virus, even with the proper PPE. So I, followed up with people I know in upper management. I even called employee health. Both said whether or not you had PPE on at the time of care, your manager is supposed to notify you. And I was never notified. Oh, I even approached the manager. She was very nasty whenever I asked her about it. And, I didn't get the answer I needed. In an email I sent her, she told me that the only people that were being notified were those that had direct contact with the patient prior to being put on enhanced precaution. I didn't feel comfortable with that, so I waited to see if somebody else might have had a similar situation, like one of my coworkers. And it did come. One of my coworkers, same situation as mine, on enhanced precautions at the time of care. Her patient ended up positive. She was contacted by our manager. And so I sent her another email asking her again, why was I not notified of my patient's positive status? And then that's when she said, call me. No, you're trying to say something in a phone call that you can't say in an email. That's what it is. You're trying.
She don't want to keep that paper trail.
Thank you. And that's what I was trying to do, keep a paper trail on her because she knows she messed up. She knows that she messed up. And so, you know, I think that this was retaliation against me because I was on her ass about not notifying me. Okay, and let me just make it clear. Not one time did I bash my hospital. Mm-hmm. When I made that video, I wasn't thinking, oh, you still have your freaking badge on. There was so much that occurred before that video was made that pushed me to that point. So prior to that, all weekend long, my family, my husband, they're all saying, Melissa, we don't think it's safe for you to go in there because my hospital has one of the highest cases in the state of Georgia. My coworker, she even called me on the way to work. She said, I'm about to call and see where they have me scheduled tonight because if they had me going to the corona floor, I'm calling out because they're not making the travel nurses work these floors or float to these floors. They're getting paid the hazard pay. We're not getting paid anything. We're not getting paid anything extra for this, okay? And it's not about the pay, but you're paying these other people $5,000. Why is this nurse? I don't know if the other floors are doing it. Why is she not sending the travelers, but you're sending your regular staff, and we're not even getting paid extra for it? So question,
nurses don't, healthcare professionals don't get hazard pay?
Not in my area, they don't.
Now, Charlamagne, you just asked about hazard pay.
Yeah, I asked do nurses get hazard pay. She said, you know, not in her area.
Not at her job. Mm-hmm.
Right, we don't get it.
So Melissa,
so what do you hope? What do you hope to gain from all of this, Melissa? Like, what are you hoping to get out of all of this?
I wasn't trying to gain anything. I didn't even think it was going to spread like this.
Right, it organically went viral.
That manager needs to
you
go.
What?
I'm not the only one that quit that day on my floor because of her. Yes, like I said, there's so much more to this story, y'all. When I gave her a chance, everybody knows details. They will know I made the right choice. This was purposely done because she knew that I was on her ass about not notifying me about my patient's positive status. That was wrong. That was
Melissa. Would you go work at another? Would you go work at another hospital right now?
If they place me in the right areas, of course. I don't want to be subjected. I was already informed by my charge nurses that I work with. They said they told the manager of my status, my prior medical history. And she assured me, she was like, you don't have to worry about being assigned to those patients. You never should have been assigned to that first patient.
Right.
They assured me. And so if I don't have to go to this other patient, why are you going to send me to a whole freaking unit of those patients? Even the nurse that gave me that first patient, she came to me and she said, oh my gosh, Melissa, you should have told me you're a breast cancer survivor. I never would have sent you to that patient. And she's the same one that was there the day I quit. This was purposely done, and nobody can tell me otherwise.
Yeah, I mean, the only way America can get the best out of their healthcare professionals is to treat them with care. If you all aren't feeling like y'all are being cared for, how are y'all going to care for other people?
I need to also add this. Last week, or the week before last, they've been floating an older nurse with a breast cancer history around trying to keep her in safer areas because she usually works in the ICU. She had been working on my floor for a couple of nights. They sent her to the corona floor. That nurse manager called my manager and, trying to get her back on my floor. My manager refused. That manager told her, from what I'm being told, we must not only look out for our patients, but we have to protect our staff as well.
That's
this
true.
This manager refused. It's a pattern with this person. So,
okay.
Like I said,
so it was something personal. So this was not something that's going on everywhere. This is just something that you feel like this manager made some poor decisions and had a personal issue.
Exactly.
Now, do you guys have the PPE? Do you guys have the necessary the PPE that you guys need?
There's a nationwide shortage, so we are having to reuse the same gown and same mask the entire shift. Prior to this outbreak, that was not the standard. And I don't feel comfortable with that, and neither do a whole lot of people. That's unsafe. I'm sorry.
Right.
I agree.
Not safe at all.
I think this is an indictment of America's healthcare industry more so than it is an indictment of you.
Well, Melissa,
we do appreciate you, for letting us know the real behind the scenes of what was going on.
I thank y'all for letting me share my side.
Oh, Melissa, can I ask you one more question? Do you think it's possible that being that this is a new situation that, nobody has ever dealt with before, maybe your manager just didn't know what the proper protocol was?
She knew. She knew.
Okay.
No, she knew.
Well, thank you, Melissa, for so much for checking in, and shout out to your family, Shaniqua, for hitting us immediately. Thank you.
Yeah. And salute to all the healthcare professionals. And I'm just going to assume Shaniqua was black.
Yeah,
I don't know why I just thought
she's
that.
black. No, she's black.
Okay.
And PPE, for people that's asking, is personal protective equipment. That's what they call when they say PPE. That's what that means.
This channel is dedicated to bringing truth to power and engaging our enemy with intellectual warfare. The dominant society will never switch up their playbook, so we must make a new one. The war we find ourselves in is a technological war, using technology, propaganda, and psyops to oppress and control you. Black intelligentsia, please share the new black media, counter propaganda arm, Make It Plain TV.